Hello, I'm Dr. Maurie Markman from City of Hope. I wanted to briefly discuss a very interesting paper. Paper itself, the data are interesting. The implications, I think, perhaps even more interesting. The paper itself has a pretty standard academic title, but again, I think its implications are what I really want to briefly highlight. Paper is titled National Estimates of the Participation of Patients with Cancer in Clinical Research Studies based on Commission on Cancer Accreditation data. This was published in the Journal of Oncology earlier this year. The authors start by noting that there have been estimates that 2 to 3% of cancer patients actually participate in clinical trials. Now, this is an hour conversation about why that is, what the implications of that are. It's sad. We're making decisions about treatment of 100% of patients based on 2 to 3% of participants. Older patients, for example, make up the vast majority of cancer patients, are grossly underrepresented in trials. All of that we know about. But this particular analysis, as I said, looked at data from the Commission on Cancer and came to the conclusion that, in fact, somewhere around 7% of cancer patients participate in treatment trials. Now, some have lauded this, stated this with this report isn't this great? 2 to 3%, we're twice as high. You could look at that and say, wow, this is now an accurate analysis and it's atrocious. 7%, okay? Not even 1 out of 10 patients, even if this is accurate. One can challenge, I believe, not that the author did anything wrong, because I can't come up with a better way of doing it, but, was the data from the information that was sent in from each of these hospitals audited? You can understand why an individual center might beef up their accrual for a variety of reasons. I don't know if it was audited, wasn't audited as a source of truth. I think one needs to ask that question. But again, the major point here is it is an objective perspective to some extent. Shouldn't be ignored, but still, it's only 7%. It's noted that, in fact, NCI centers had about 22% of their patients. So you can say NCI centers only 22%. Well, again, much to discuss about that, but that's still only 1 out of 5. And community programs, where in fact the very large majority of patients with cancer are cared for. 4.1% of patients participated in therapeutic trials. There was a group called Integrated Network Centers of 5.7%. So again, the number is 1 out of 20, 1 out of 15, certainly less than 1 out of 10. Do we need to do a better job? Yes. Do we need to figure out why we are not having trials that are, quite frankly, relevant for the vast majority of our patients? Why is that? Can we do better? Can we develop pragmatic trials that are answering questions that are relevant to oncologists every day for their patients, maybe even for the majority of patients? We figure out a way of paying for this. We figure out a way of doing it easily. So many questions to ask. Again, an interesting point, 7%. Okay, we can perhaps quote that now, but still far from adequate. And I thank you for your attention.